Hey guys, my name is Ali Camerata. I'm an occupational therapy student at Midwestern University, and for my activity analysis class, I designed an OT toolkit. The name of my toolkit is the Kickstart Coloring Kit, and it targets a wide variety of client populations that works on fine motor skills and hand strength. And in this kit, we're going to just focus on writing and coloring. So let's just check out what's in my toolkit. Alright, so I have some large white paper, no lines. Okay. And we have a medium-sized piece of paper, just a regular 8.5 by 11 computer paper. And then we have a fun Disney Winnie the Pooh coloring book that incorporates what we're going to be working on, which is shapes and sizes and colors. Okay, so that's for our drawing supplies. Then we have some scissors, which I'll talk about in a minute. We have pencil. And we have jumbo crayons. So the width of the crayon is a little bit thicker than a regular crayon. And then we have regular crayons, which this one conveniently has a sharpener, which is pretty cool. Never seen that before. So this is just a regular standard size crayon. And then we have colored pencils. I put a Sharpie in there. And then we have a standardized, just a regular rubber pencil grip. And then I picked this up. This is originally just like a finger shooter from the dollar store, but in a minute I'm going to show you what it's actually going to be used for. So all this stuff I purchased at the dollar store. Really convenient for prices and everything. All right. So in this toolkit, we're going to be focusing on two client populations. One would be kids between the ages of 2 and 3 years old. Could be younger, could be a little bit older, but that population that's going to be working on fine motor skills and muscle control, and they're going to be learning how to draw straight lines and curly lines, and eventually learn how to write. And then the other client population that we're going to focus on is individuals with cerebral palsy who have low muscle tone and have trouble grasping and gripping utensils or coloring supplies that may be difficult for them to learn how to write or color. So how I would go about beginning this with a child that is first learning how to draw, is I would assess them by taking a plain piece of paper, just 8.5 by 11. And this is a very interactive activity, and so the teacher would be the one using the Sharpie, and they would just draw a straight line. So for the activity purpose and showing you, I'm going to use my left hand because I have less motor control in my left hand. And so the child, after you draw the straight line, you would then assess them by seeing if they can stay on the on the line. So in this, you're going to be checking to see how they hold it, if they have their pincer grasp down or if they're palming it, which is very it's typical for kids when they're first learning because they don't have the pincer grasp yet. So in the case where they don't have the pincer grasp and they're holding it like this, or they're jamming it down, or they just have low, like they don't have a lot of control over the crayon, I would grade the coloring utensil down by trying a jumbo crayon. So this gives it a little bit of a thickness to it that will be easier for them to hold. It's a little bit heavier, and so they could try using the pincer grasp, which they may have more success. So then again, you would have them, you draw another line or have them use a different color, and then just see how they perform the activity of just completing the straight line. And so once they, manage to get through the line, then draw a straight line, then you would get back down to the regular size crayon. And then once they've mastered that and you feel like the lines are steady, their hand steady, their pincer grasp is perfected, and they're not pushing down too hard on the crayon, because that's not another sign of them not having control over it, is that they're pushing down too hard on the paper. But so once they have a light and even stroke and they have control over it, then you would grade the assignment, the activity, up by using colored pencils. And this is an advanced skill because, as we all know, colored pencil tips break really easily if you push down too hard. So then, then if they've perfected that, then they can go to colored pencils. So that's how I'd grade down and up the activity of just using different coloring materials. And so if for any reason the size of the paper doesn't work for them, you can grade up and down based on their needs. So if they have poor muscle control over their arm, their whole arm starting, in the shoulder, then you can grade down by using a bigger piece of paper and allowing them more freedom and more room to perform the activity. So your lines could be bigger, or you can have them free draw, free write, and just practice using the pencil and keeping it on a larger surface. All right, so we've discussed how the difference in the crayon width. So we have the thin crayons, we have the jumbo, and we have the colored pencils. So one thing that would be helpful is if a child is up to using the colored pencil, however their pincer grasp is still not 100%, you can adapt the task by using a pencil grip. So you would put the pencil grip on the colored pencil and then give it back to the child, and then they would continue with the activity. So another way to upgrade this project and working on fine motor skills and developing their ability to trace is by having them use a coloring book. So if they're at the stage of the colored pencil and the pencil grip, you would give the book to the child, and this is more of an independent work. And then you'd have them basically just follow the lines and trace, or if your instructions are to color in the square, then the rectangle, then you would watch them color in the square and make sure that they're coloring in the lines. And then just make it fun for them and have them just work on drawing those lines that you were drawing on the other, the plain piece of paper, drawing that you were doing on the plain piece of paper, and having them practice that. So that's a way to upgrade your writing task. All right, so the other patient population or client population that I'm going to be talking about is our patients that have cerebral palsy. So we're going to go back down to the large piece of paper, and we're going to bring out my handy dandy finger shooter that I bought at the dollar store. And this is where we bring in our scissors. And then we have our crayon, large crayon, and a small crayon. So again, with this assignment, and actually you can use a small piece of paper. So for this assignment, same rules apply. I would assess the client to see where they are. You would draw the line for them with your Sharpie or pencil. And then you would assess where they are, if they're using the thin crayon. If they can't grab onto the thin crayon, then you would then give them the jumbo crayon and seeing if they can hold on to it. Or if they're ready to rock and roll and they're down with the colored pencil. In the case where you need to adapt the task for them to even work on this activity with their peers, you would adapt it by, now I'm going to use this, by making a mold or customizing a grip that will increase the width of the colored pencil or crayon to help them grasp onto it. So I'm going to use this foam, and I'm going to use the colored, use the scissors, and I'm going to cut it in half. And then you can either put the thin crayon in one side and just kind of shove it in there, or on the other side, actually, or on the other side of this, you can stick the larger crayon in. And if it doesn't work there, you can always build it up with tape so it will stick in appropriately. This actually came with a little rubber band, so I'm going to stick the rubber band in and just give it a little bit extra width so it sticks in there. So then you just have them grab onto it however they can. So some of them will be using a wider grip and using most of they're going to be palming it. They could do that. Or if they're ready to use a thinner crayon with their peers, and they're working on their pincer grasp, then you have more of a weight to it, and it's also a thicker base. So then they can participate with the same utensils that their peers are using, and that's how you would adapt the task. And then when they're ready, you can either, say with the same size, you can change the shape. You can have them work in a bigger area, so you'd have them either color in the lines and draw lines, or color different shapes, trace different shapes, dotted lines, letters. So that would be for just a regular 8.5 and 11. If you need to grade down that activity, if they have lower motor control and lower tone, you may want to start by grading down and just giving them a wider space to work with, a larger space that they can free draw and just work from there. And then when they're ready, you can also grade up the activity. Again, if they need to keep their adaptation, they can. Their customized coloring utensil. And then they can work in the same booklet as their peers, and they can work on coloring from dot to dot, coloring in the shapes, and that would be working with kids or adults with cerebral palsy. All right, everybody, thank you for watching, and this is what's in my Kickstart coloring kit.